Welcome to the MamasteFit YouTube channel. In this video, we're going to be doing a birth prep mobility flow that you can do towards the end of your pregnancy, really anytime throughout your pregnancy, but you may want to focus on it more in the third trimester or even in early labor to help create space in each of the pelvic levels. Hey, my name is Gina. I'm a perinatal fitness trainer and birth doula, and I'm currently pregnant with baby number 4, and I want to share the mobility flow that I've been doing to help create space in each of my pelvic levels. When it comes to the pelvis, there are 3 main levels, and they all open in a different way. The top of the pelvis is the pelvic inlet, and this is going to open more with external hip rotation or knees coming out with that abduction, and this helps to create space side to side in the top of the pelvis. In addition to that external hip rotation, being able to move the sacrum from front to back can help to create space forward and backwards with some pelvic tilting type motions. After your baby has engaged or entered into the inlet, they're then going to move through the mid pelvis, which is the bony structure of the pelvis. The mid pelvis opens more with asymmetrical type movement patterns or shifting our weight from side to side with more of those open hip positions and closed hip positions. The mid pelvis can be divided into 2 levels. We have the upper and the lower mid pelvis that opens in a slightly different way, but as long as we are kind of shifting from side to side, we are generally creating space throughout the mid pelvis. The bottom of the pelvis is a pelvic outlet, and this is where your baby's going to finish their rotation and extend while you're pushing. The bottom of the pelvis opens more with internal hip rotation or knees in, ankles out, and this creates more space from side to side. But we also want to target sacral movement. We want the sacrum to freely move, and being able to release tension in the posterior pelvic floor is going to be really beneficial for that. In this workout, we're going to be incorporating a variety of hip mobility exercises that target each of the pelvic levels. As we go through the workout, I'll explain how each of these exercises is helping to support your birth preparation. If you want more support throughout your pregnancy, be sure to check out our online prenatal fitness programs. Our online prenatal fitness programs are offered in 2 main formats. We have our app-based program, which is going to be our strength program. This is going to be a list of exercises with short demo videos, and this is going to be a self-paced workout. So if you enjoy working out in a gym setting, want to lift with the barbell, this program is going to be a great option for you. It syncs to your current week of pregnancy, so you can start it at any time, either with a one-time payment to use for this pregnancy and for future ones, because you do get lifetime access, or you can only pay for the months that you need and cancel at any time. In addition to our prenatal app program, we do have an on-demand program, which are going to be full-length workout videos more similar to this, where you follow and work out with at the same time. Both the app-based program and the on-demand-based program are going to incorporate strength exercises, mobility exercises. We include pelvic stability and birth prep workouts in addition to pelvic floor release because we want to help you stay strong, pain-free, and then help you prepare for birth. You can check out all of our prenatal fitness programs on our website at MamasteFit.com, and you can use code YouTube10 to get 10% off, and then you can bundle them with childbirth education and pelvic floor prep to save an additional 15% off. So let's go ahead and move into the birth prep mobility flow. For this flow, all you're going to need is a yoga block and a bolster. Once you've got that equipment, let's go ahead and get started with the flow. We're going to start the flow with a pigeon pose. So we're going to bring the feet in front of us so that the ankle is stacked on top of the knee and then vice versa. And then from here, if you have like a really big gap between your knee and your ankle, feel free to put that pillow there to add a little bit of support. And then you can just kind of lean forward, and we're feeling this more in kind of the external rotators of our hip. So big breath here. So we'll just spend some time first breathing into the hip. We'll do 1 minute on this side and then a minute on the other. And then if you want, you could add like a little bit of rotation just to kind of explore how that feels for you. You may find that you don't want to rotate, you just want to stay forward, and that's totally fine as well. If we come forward, we're thinking kind of push belly towards the floor or to the legs instead of rounding in the back. That's going to help keep you in the hips. In about 10 seconds, we'll switch to do the other side. Let's go ahead and switch. So other ankle is now on top. Again, if you have a big gap, it may be more on one side versus the other. Feel free to put kind of that pillow there or that soft object just to add a little bit of support. And then we're going to lean forward into this. And so this bilateral externally rotated position where both legs are in more external rotation helps to create more space in the top of the pelvis side to side. So the pelvic inlet, where your baby enters, opens more with wide knee positions and external hip rotation with abduction, so the legs moving away. And so movements that are like traditional birth prep exercises like deep squats, butterfly pose, pigeon pose are all really wonderful to helping to create space in the top of the pelvis. But we're going to move through a series of movements that create space in the other parts as well. And now we're going to come into a half lunge position. So you can come down onto your hands and you're going to bring the foot out so that we're kind of at this like diagonal position. If you need a little bit of support, you can place your yoga block down on the floor as well, either flat or whichever. And then we're just going to kind of rock back and forth into that hip, shifting forward, or this, I guess a little bit more diagonal, and then back. So we'll do about half of the minute with the hands down on the floor, and then we'll shift to come up. You can even use your elbow that's closest to your leg to kind of push against it as you come back to really emphasize that extra rotation on the one side. And so if you want to come up, you can also come up as well. So we're still driving into that hip, but now we're just in a different position. If you liked it with your hands on the floor, feel free to stay there. In about 5 seconds, we'll switch to the other leg. So go ahead and switch hands down on the floor, and now we're shifting into that hip. You can also, again, use that free or that closer hand to press into that knee. So this movement is helping to open the upper mid pelvis. So after baby has entered into the pelvis, they have to begin to rotate towards the front. And one-sided open hip positions where belly is away from that thigh helps to create space in that upper mid pelvis so that baby can begin their rotation. And so if you're having any issues with baby like engaging or like getting deeper into the pelvis, sometimes savoring like an elevated lunge or even a half lunge like this with the birth ball can be super helpful. If you want, sorry, I didn't cue it, you can come up and shift back and forth into that hip. I was kind of lost in my train of thought. And now we're going to straighten that leg to come into an adductor rock back. So hands will be in front, and then we're going to shift back into that hip. And if you want to drop down to one side elbow, you can to kind of increase some thoracic rotation to bring you a little bit deeper into the inner thigh. So go ahead and rock back. If you want to drop down to that elbow, feel free. And now you could just stay here and breathe, or you can come forward and backwards. And so for the rotation, you can either just drop to the elbow, or you can even reach up towards that opposite side, whatever feels better for you. And so this is another upper mid-pelvis opener. It's stretching more of that inner thigh, making it easier for us to find more of that external rotation on one side. Again, helping baby begin their rotation. Five seconds, we'll switch to the other leg. Let's go ahead and switch. So straighten that other leg out, shift back, find the rotation if you'd like to move a little bit deeper into that hip, to that inner thigh. You can reach up towards the ceiling. You can just tent the arm out. And you can also just stay at the bottom. You don't have to rock back and forth if you just want to spend a little bit more time kind of exploring how it feels for you. Now we're going to come into a 90-90 position, and we're going to do some 90-90 switches with a side camel at each end point. So we'll start in this 90-90 position. One leg is in front, the other leg is to the side. So start by reaching towards the internally rotated leg, and then extend in the hip to feel that hip flexor stretch. Hands come behind. You roll over the feet to the other side. And so side body opener, extend in the hip, hands come behind, and then rotate. And so there's a few different movements going on here. This is a great mid pelvis opener, so creating space in that middle of the pelvis where baby is rotating. Typically, you don't need to hyper focus on, I need to open my upper mid pelvis right now, I need to open my lower mid pelvis, unless there's some sort of issue with baby's position. But in general, you can just focus on creating space throughout the mid pelvis with these asymmetrical movements, hip shifting, shifting your weight from side to side. And now we're going to keep going here because we've got a lot of movements going on. So we're doing 2 total minutes of the side body opener, that hip extension, and then switching to the other side. If you get a little like off with which arm goes where, it's okay. So that side body opener is helping you find a little bit more internal hip rotation. That hip extension should feel pretty good in that hip flexor round ligament area. So it's one of my favorites to do if I'm having more round ligament pain. And then the alternating between external to internal hip rotation is so beneficial to creating space within that mid pelvis, which is the narrowest space. And usually where babies spend most of their time. So now let's grab onto your yoga block, and we're gonna start targeting the lower mid pelvis and the bottom of the pelvis. So grab your yoga block, you're gonna place one knee on top, and then from here, I'm gonna shift my weight over towards that elevated hip so I can lift my lower knee without really changing my body position. And then I'm gonna drop my belly to the floor, exhale, pull belly to spine to round, keeping my weight shifted to that elevated hip. Now it's the engagement of my core that is rounding my back, not the clenching of my glute. Hip shifts are really great for creating space in the lower mid pelvis where baby finishes their rotation. This also tends to be a place where baby sometimes gets like quote unquote stuck. Not every baby, but if I see labor stalls in the births that I support, it's usually related to the lower mid pelvis, especially if it's like a late stall. So you're like 8 centimeters, you've been pushing for a long time. So being able to shift your weight to one hip is really beneficial to supporting that rotation. Let's go ahead and switch sides. So place the other knee on that block. Again, shift that weight over. You should be able to lift that bottom leg without changing your position. And then drop the belly to the floor. Exhale, pull belly to spine to round. So you can even throw a yoga block in your labor bag. And so if you do get an epidural or you're trying to labor in the bed for whatever reason, it can be a really nice place to labor because it's soft. You can always throw a yoga block underneath your knee to help you get into that hip shift to create that space for baby to finish the rotation. So if you've been pushing for a long time or like you're kind of stalled at 8, finding those hip shifts can sometimes be the key to helping baby rotate. It's also a great posterior pelvic floor release exercise. So doing the hip shifts can make it easier for your sacrum to move, which creates tons of space front to back in the pelvis. And now we're gonna finish up with some pelvic tilts with internal hip rotation. So knees are in, ankles will be out. And we're going to drop the belly to the floor and then exhale to round. And again, it's that core engagement of pulling baby up that's bringing that rib cage and pelvis closer to help us round in our back. And so the bottom of the pelvis opens more with knees in, ankles out, or internal hip rotation. So movements where we have that internal rotation creates more space side to side in the pelvic outlet, which can be really helpful when you're pushing. During pregnancy, finding more of that internal rotation and hip shift tend to be a little bit more challenging, which is why we start all of our workouts with the MamasteFit birth prep circuit, because it incorporates movements to make that easier for us to do. Thanks so much for joining me for this birth prep mobility flow. You can do this flow really anytime throughout your pregnancy, but you may want to do it a little bit more in the 3rd trimester. You can even do it during your early labor to help create space within your pelvis for your baby to begin to enter, rotate, and then be born. If you want more support throughout your pregnancy, be sure to check out our online prenatal fitness programs. We offer it in our app-based format in addition to our on-demand based format, so you can choose what works best for you. If you already have a workout program that you really enjoy doing, we do have just our birth prep program as a standalone, which has all of our birth prep workouts, pelvic floor release workouts, and mobility flows like this to help support your birth preparation. You can check out all of our courses on our website at MamasteFit.com. And again, you can use code YouTube10 to save 10% off any of our online offerings, both for pregnancy, for postpartum, education courses, or fitness programs. And again, you can bundle prenatal fitness with childbirth education to save an additional 15% off. If you enjoyed this workout, be sure to like and subscribe to our channel so you get notified whenever we release new workouts. We release one new workout every week and tons of educational content throughout the week as well.